As the world has seen, the COVID-19 has a greater impact on the elderly more. It is then urged that the elderly, the senior citizens, to refrain from crowded places. They should at all times safeguard themselves as the infection has a higher rate impact on the elderly, states the Chief Minister in his daily briefing on the 20th April. On a query about a body management protocol, the Chief Minister informed that the state government is fully prepared with it and it has already been circulated to all the DCs in regard to essential intervention at their level. Meanwhile, informing that the stranded migrant workers from different parts of the country are being taken care of during this lockdown period to tackle COVID-19 pandemic. It is nothing short but a necessary protocol for the state government to provide assistance on all migrant workers, as every state government in every part of the nation is required to. Appraising that, the state government has been providing food and shelter for all migrant workers during this crisis. Furthermore, the Chief Minister apprised on the concern raised about the mining areas in and around Meghalaya, to which he clarified that there have been suggestions bestowed upon the state government to establish relief camps in pertaining mining areas, as there are a number of labourers taking shelter. To which Conrad informed that the suggestions have been listened and taken up in most mining areas, but if there are any mining areas that are being left out, he assured that he will take up the matter to ensure that necessary steps are coursing to make ends meet. The Chief Minister informed that financial aid of Rs 3,000 each will be granted to Meghalaya residents stranded in different parts of the country under the Chief Minister's special grant, which is in the process. He informed that the grant has been sanctioned to a list of 1,617 people and the remaining will be released in the coming days. Screening and testing of drivers designated in supplying essential commodities in the state, the Chief Minister states, "We are disinfecting the trucks and the vehicles that are coming into our state. There is a delay in the transportation of products because these processes and protocols are being followed." Most significantly, the Chief Minister urged the general public, especially parents, not to encourage the children to venture out and engage in outdoor games in locality streets.
Very good evening to everyone and welcome to the daily briefing. Friends, as of now, the total samples collected is 838 and the total number of cases tested negative is 714. We have another 113 cases where we're waiting and 10 active cases as of now, and we are also all the 10 active cases as of now are stable and they are all quarantined. And at the same time, I would also like to inform you that apart from other programs which I have spoken about in my previous briefings, we have also started the distribution of financial assistance under the CM's special grant for individuals stranded in different parts of the country. For this purpose, we are categorizing, and there are different categories of workers, students, professionals and others, and therefore we have selected the workers group first, and as we speak, the money for supporting them, that is a lump sum amount of 3,000 rupees, is being given to 1,617 people stranded in different parts of the country, and we will continue this process, and other categories also of students and professionals also will be ultimately given the money under the Chief Minister's special grant. Apart from them, friends, I would like to take this opportunity today to share and to discuss and to address some of the concerns that some people have raised. Number one, of course, people have talked about the ambulances and that some of the ambulances are not in good condition. We are very aware of it, and that's the reason why we decided that we will be giving the money of the Chief Minister's Relief Fund for procurement of 25 ambulances. Apart from that, some people have also raised concern about the drivers who are delivering the different essential commodities. Are they being screened and tested? Yes, friends, to inform you, we are doing that. We are screening them, we are testing them, and we are also disinfecting the trucks and the vehicles that are coming in. and that is also one of the reasons why sometimes there is delay in the transportation of products, because these processes and protocols have to be followed. Friends, also I would like to request our locality headmen and also the parents and elders in the house that 2-3 things I think is very important we need to do as a society. Number one, I think we are seeing that during this period of lockdown, a lot of children are coming out and playing, and I think in that the norms of social distancing are not being followed. So I would urge if these kind of activities could be monitored and could somehow be controlled, and social distancing could be maintained. Secondly, I would also request that the virus as such is something that we have seen throughout the world affects the elderly more, and therefore I would urge that if our elderly, our senior citizens, if they could refrain from going out and they could keep themselves safe, because this virus is something that we have seen throughout the world affects the elderly more. So I would urge our elderly and our senior citizens to refrain from going out as far as possible. There have also been some suggestions coming in that we can have some of the notifications and the information that is related regarding COVID and regarding government programs in different languages, especially in Khasi, Garo and Hindi, and we are making arrangements for that, and we are also getting medical professionals on board now to give medical advice to our people in different languages. Friends, there has also been concern raised about the body management protocol. We have already prepared that body management protocol, and it's being, in fact, is already been circulated, and a conference of the DCs was held through video conferencing. They have all been sensitized about it, and all of them are in the process of implementing it. So this body management protocol is something that is being worked on by every deputy commissioner in different districts. Friends, there were also some issues about the laborers from different parts of the country who are in the state, stuck in the state. Some concerns about who is supposed to take care of them. Well, it's very clear that every state government in every part of the country is supposed to take care of all migrant laborers. So like it's being done in other parts of the country, even the Meghalaya government has been supporting and taking care and providing shelter to all migrant laborers who have come here from different parts of the country. And there were also concerns about the mining areas, and I think some suggestions came in that there should be some relief camps set up in those mining areas also, because a lot of laborers are there. Friends, that also has been done in most of the mining areas, and in case there are any areas that are left out, I will once again check on that and ensure that all steps are taken, that we can take care of all those also. Apart from that, different suggestions have come from different parts of the state, and I cannot go through all of them, but I thank all of you who have sent those positive suggestions, and will be definitely taking all those into consideration. So with this, I would like to end the briefing for today. Thank you very much.